Hi, welcome back to my channel. Thank you for joining me. Please like, share, and subscribe. This is Dr. Erica Onagbola, pharmacist. Since 2013, you're welcome to my channel, my main channel, Erica OnagbolaPharmd. I just want to briefly talk about a new multivitamin from Nature Made gummy formulation that I recently purchased on sale, and you can go and purchase a set of 1 month supply, 6 month supply of a multivitamin. So the multivitamin is a multivitamin for women. They have a age range for 50 plus if you're interested in that, or they have the regular, and I purchased the regular just because I wanted to make sure I was being compliant with the indication. So it's two gummies per serving, and there are 70 gummies in one container, giving 1 month supply or 35 days of use if you do the calculation. So I'll show you. That is just general folic acid and vitamin D. And then there's also going to be vitamin C, vitamin E. All of those are good for eye health, for skin health, for bone health. They have zinc as well. They have carbs in them, 4 grams of carb. And I will say they are sweet. I will say they are sweet. So if you're diabetic, it says the sugar amount. If you're diabetic, be careful. Sugar amount 3 grams includes 3 grams added sugar. Okay, and then there's niacin, there's biotin, which is good for nails, for skin, for hair growth and protection. And then there's also immune health with the zinc, appetite increase, enhancing with the zinc as well. If you're someone who is having or going through a perimenopause or menopausal and you're having issues with your diet or your digestive system, then there is some zinc in here. And the zinc is also good for the immune system, to help boost the immune system, help to get the immune system active, get those antibodies going. So that's good as well. There's chromium, which helps to fight the metabolism of fat, helps to break down fat, and also protein that you ingest. So that is going to be good as well. Chromium 17.5 microgram. And again, that's good for the digestion of protein, for fat, and for the metabolism as well. Helps to increase the rate of metabolism, helps to break down those proteins very well. If you're someone who has liver issues or someone who has digestive issues, chromium is good for those patients. And this multivitamin product does have the chromium component as well. I'm reading the nutrition label, and I read it earlier, and I just wanted to make sure I let you know what is in here. Folic acid, if I haven't said that before, then you're getting niacin and biotin, which is going to be found in your hair, skin, and nail vitamin products that you see on the counter. This one might have a little bit less than the hair, skin, and nail formulation that's on the market, but there is some in here as well that will help if you're someone who is conscious about your nail fragility and or the fragility of your nails. Because after some time, when we get older, as older females, our estrogen levels and our progesterone levels, they change, they alter, and when they do that, our nails become more prone to cracking and breaking. So do be on the know about that. Strawberry flavored, they were on sale for two, I think two for like $11. So that's going to be uh 60 days. So the first bottle is 2 gummies. The second bottle is going to be also 2 gummies. That'll give you 60 days or 2 months worth of vitamins. And then it's gummy, so it's going to be very chewy. Based on my feedback, it's going to be chewy. It's going to be very sweet. and it's going to, and texture is very smooth, and it like melts in your mouth almost, if you ask me. So there's not a lot of, gumminess to it, and it is smooth going down. The taste is very sweet, like candy almost. You just want to keep taking it. I had to stop myself. I was like, this is not candy. This is a multivitamin. Go ahead and be compliant with what it says. So, um, do take a meal if you want to before taking a gummy vitamin. Separate your vitamins from your medications that you're already taking so that there's no interference when they're taken together. So I would say separate your medication, prescription medications, maybe 2 to 4 hours apart from your multivitamin. That will help decrease the drug to drug interaction that can occur in the stomach and digestive system lining, because a lot of the calcium that's in these multivitamins, the potassium, all of those are electrolytes. They can bind to other medications or prescription medications that you may be taking. And when that binding occurs, there'll be a delay in absorption, and that will slow down the pharmacokinetics. And so there might be a different effect or of efficacy and safety of your prescription medicine. So anytime you're taking an electrolyte, whether it's an antacid or multivitamin, do separate it, maybe 2 to 4 hours, because you just want to make sure you're getting all of your medications from all the benefits from all of your medications. You don't want to you don't want to have that interference to go on. It might be a minor interference, but it's going to be something that could be detrimental with, depending on what other prescription or what other drugs you're taking. And then you can pick these up just over the counter. I didn't have to go too far from the pharmacy. They were right there at the pharmacy department. Nature Made. You can also get Nature's Bounty. There's all sorts of off-brand labels if economics is an issue. But do be aware. Let's see. It says caution if you are taking medication or have blood clotting issues. Consult your physician before use. Biotin may interfere with lab tests. If you're planning to undergo lab testing, consult your physician before use. And inactive ingredients: glucose syrup, sugar, water, gelatin, citric acid, palm oil, natural flavors, color added, carmine, no synthetic flavor, no synthetic coloring or dyeing, high no high fructose corn syrup, no artificial sweeteners, and it's gluten free. But that I can tell it does have sugar in it because it tastes just like a child's piece of candy. If you ask me, I do understand that they have some flavoring in here, but not the carcinogenic one. They don't. They're red in color, and I did make sure that they did not. You can see the red orange color there, that they don't have any artificial dye. But yes, they do have gelatin, citric acid, and palm oil. Palm oil is like it's tropical a tropical environment derived oil, and it doesn't have a lot of nutrition to it. It's good. It's very flavorful, but there's not a whole bunch of nutrition in it when you're like comparing it to your olive oil or your coconut oil. Those particular oils are monosaturated fats. Now, the palm oil is not a monosaturated fat, but it does have flavor to it. But the nutritional value is very low compared to for example, olive oil or coconut oil, or those those oils that you use on a daily basis for nutrition. So do be aware if you want to purchase this item. The active ingredient and inactive ingredients are very important. So I do want to reiterate that. And they are, I want to say this: over the counter products are not FDA approved. Again, over the counter products like your vitamins, your minerals, your supplements, your dietary supplements, they are not FDA approved. They are only approved or on the market because of their known scientific history or being grandfathered in to be sold or marketed. They haven't undergone any research. They haven't gone under any post research or investigation. Only if someone dies or if someone reports a catastrophic event, then will the item be under some sort of research or investigation to learn more. So no one has done that. So I decided I'm going to try these and give it a try. It was two for 11, two for $12, and they had plenty of them there. So I just grabbed a couple bottles and check out these. These were at Walgreens. You can check them out at CVS. You can check them out at Walmart. Nature made, nature made. So if you have questions, comments, please let me know. Like, share, subscribe. Thank you for joining me. Thank you for watching my videos, my main channel, Erica OnagbolaPharmd. And I hope to see you on future videos. Dr. Erica signing off. Take care. Have a good day. Bye-bye.